Performing chest physiotherapy. Percussion, sometimes called clapping or cupping, is forcefully striking the skin with cupped hands. Vibration is a series of vigorous quivering produced through hands that are placed flat against chest wall. Postural drainage is the drainage of gravity of secretion from various lung segments. First, wash hands. Explain the procedure to the client. Provide visual and auditory privacy. Assist the client to the appropriate position for postural drainage. Have the client lie back at a 30-degree angle and percuss and vibrate between the clavicles and above the scapulae. Have the client sit upright in a chair or in a bed with the head bent slightly forward. Percuss and vibrate the area between the clavicles and scapulae. Elevate the foot of the bed about 15 degrees or 40 centimeters and have the client lie on the left side. Help the client to lean back slightly against pillows extending at the back from the shoulder to the hip. A pillow may be placed between the knees for comfort. For a female, position the heel of your hand toward the axilla and your cupped fingers extending forward beneath the breast to percuss and vibrate beneath the breast. Elevate the foot of the bed as in step 6 and have the client lie except on the right side. Percuss and vibrate the right side of the chest as in step 7. Have the client lie on the abdomen on a flat bed and place 2 pillows under the hips. Percuss and vibrate the middle area of the back on both sides of the spine. Have the client lie prone. Elevate the foot of the bed about 30 degrees or 45 centimeters or to the height tolerated by the client. Elevate the hips on 2 or 3 pillows to produce a jackknife position from the knees to the shoulders. Percuss and vibrate over the lower ribs on both sides close to the spine, but not directly over the spine or the kidneys. Percussion. Ensure that the area to be percussed is covered. Ask the client to breathe slowly and deeply. Cup your hands. Hold your fingers and thumb together and flex them slightly to form a cup, as you would to scoop up water. Relax your wrists and flex your elbows. With both hands cupped, alternately flex and extend the wrists rapidly to slap the chest. The hands must remain cupped so that air cushions the impact to avoid injuring the client. Percuss each affected lung segments for 1 to 2 minutes. Vibration. Place your flattened hands one over the other against the affected chest area. Ask the client to inhale deeply through the mouth and exhale slowly through pursed lips or the nose. During the exhalation, straighten your elbows and lean slightly against the client's chest while tensing your arm and shoulder muscles in isometric contractions. Vibrate during 5 exhalations over 1 affected lung segment. Have the client to cough and expectorate into the sputum container. Offer the mouthwash. Assisting in the insertion of an oral airway and endotracheal tube. For oral airway, explain the procedure first to the client and family. Perform hand hygiene and organize equipment. Lay long strip of tape down with sticky side up and place short strip of tape over it with sticky side down, leaving equal length of sticky tape exposed on either end of long strip. Split either end of tape 2 inches. A commercial holder may also be used. Don gloves. Rinse airway in cool water. Open mouth and place tongue blade on front half of tongue. Turn airway on side and insert tip on top of tongue. Slide airway in until tip is at lower half of tongue. Remove tongue blade. Turn away so tip points toward tongue. Outer edge of airway should be vertical. Place tape under client's neck with ends lying on either side. Pull one end tape across client's mouth with splits taped across upper and lower ends of airway. Repeat with other end of tape. Suction mouth and throat if needed. Swab mouth with moisturizer and mouthwash. Apply petroleum jelly to lips. Position client in good alignment and for comfort. Evaluate respirations, raise side rails, and place call light within reach. Remove gloves and perform hand hygiene. Suctioning the nasopharyngeal and oropharyngeal airways. Suctioning clears secretion from the airway of patients who cannot expectorate and mobilize them with assistance. It involves aspirating secretions through a catheter connected to a source of suction. Move the bedside table close to your work area and raise it to waist height. Place towel or waterproof pad across the patient's chest. Adjust suction to appropriate pressure. For a wall unit for an adult, 100 to 120 mmHg. Neonates 60 to 80 mmHg. Infants 80 to 100. Children 80 to 100. Adolescents 80 to 120. For a portable unit for an adult, 10 to 15 centimeters. Neonates 6 to 8 centimeters. Infants 8 to 10 centimeters. Children 8 to 10 centimeters. And adolescents 8 to 10 centimeters. Put on a disposable clean glove and include the end of the connecting tubing to check suction pressure. Place the connecting tubing in a convenient location. Open sterile suction package using aseptic technique. The open wrapper or container becomes a sterile field to hold other supplies. Carefully remove the sterile container, touching only the outside surface. Set it up on the work surface. Place a small amount of water-soluble lubricant on the sterile field, taking care to avoid touching the sterile field with the lubricant package. Increase the patient's supplemental oxygen level or apply supplemental oxygen per facility policy or primary care provider order. Put on face shield or goggles and mask. Put on sterile gloves. The dominant hand will manipulate the catheter and must remain sterile. The non-dominant hand is considered clean rather than sterile and will control the suction valve or Y port on the catheter. With dominant gloved hand, pick up sterile catheter. Pick up the connecting tube with the non-dominant hand and connect the tubing and suction catheter. Moisten the catheter by dipping it into the container of sterile saline. Occlude white tube to check suction. Encourage the patient to take several deep breaths. Apply lubricant to the first 2 to 3 inches of the catheter using the lubricant that was placed on the sterile field. Remove the oxygen delivery device if appropriate. Do not apply suction as the catheter is inserted. For nasopharyngeal suctioning, insert catheter through the nares and along the floor of the nostril toward the trachea. Roll the catheter between 4 fingers to help advance it. Advance the catheter approximately 50 to 60 to each of the pharynx. For oropharyngeal suctioning, insert the catheter through the mouth, along the mouth toward the trachea. Advance the catheter 30 to 40 to reach the pharynx. Suction intermittently by providing the Y port on the catheter using the thumb of your non-dominant and gently rotate the catheter as being withdrawn. Do not suction for more than 10 to 15 seconds.